One of the most common disorders that is diagnosed among children is ADHD. ADHD is short for attention deficit disorder, attention deficit hyperactivity disorder. The most common symptoms of ADHD include impulsiveness, inattentive patterns, and excessive activity or restlessness. These are also typical behaviors children exert in general. Adolescents in the United States have been overdiagnosed and overmedicated, most commonly with ADHD. This is impacting children's cognitive health as well as their future into adulthood. We should not be treating children's normal characteristics as a diagnosis for medicational dependency. Since the 1980s, ADHD has been overdiagnosed in school-aged children and has led to an overmedication of adolescents around the world. Psychology Today reported on January 29, 2022, that a survey found 86% agreed that doctors are overmedicating children with behavioral problems. 2/3 agreed that medications have long-term negative developmental impacts and delay solving the child's real problems. And slightly over half of the participants agreed that medications blunt children's personalities. The diagnosis and medicational impacts on children are not only influencing their personalities, it's also singling them out in many life settings. Mad in America reported in their article, which they published on May 3rd of 2021. The researchers found that receiving an ADHD diagnosis also increased stigmatization. The diagnosis can increase and create an identity that enhances prejudice and judgment, which are associated with an even greater feelings of isolation, exclusion, and shame. Negative associations that come with these diagnoses shape the children's future behaviors and introduces future risks into adulthood. The New York Times on May 25, 2021 reported one longitudinal study focused on girls and young women. They found that subjects who had been diagnosed with ADHD as children showed marked impairment 10 years after their diagnosis. It included a high risk of self-harm as well. People with ADHD are also more likely to be unemployed and therefore uninsured. The heightened influence of overdiagnosis and overmedication has on children's mental health, personality, and future success into adulthood are reason enough to seek alternative therapies before resorting to a medication dependency to fix adolescent behavior. One alternative therapy that families could attempt before resorting to a firm diagnosis, or even if there already has been a diagnosis of ADHD, is to seek behavioral therapy. Another option is that when children are presenting severe symptoms, they should be adequately treated with their development in mind. It's important to note that children's brains and bodies are not fully developed. This is why it's so easy to overmedicate our young. With that said, there should be a finer spectrum when it comes to diagnosing and medicating children, especially since the most common symptoms of ADHD are also typical child behavior. In the end, it's up to the parent's decision whether the risks of medication prescribed and the impacts of their children's overall well-being is worth the risks of overmedicating. A quote from a medical facility Hillside CEO, Joseph M. Costa, heeds the warning. Overmedication is a symptom of a system that is haphazard, uncoordinated, and driven by the need to safeguard its own interests rather than that of the children it serves. This is why it is so important that we keep our children's health in mind and we stop overmedicating if necessary.